His dad's own journey through ill health without insurance prompted Air Force veteran Chris Rowe to enter the Democratic congressional primary in Tennessee's 1st District, and a single-payer system is his signature issue.
That was a real wake-up call for me. I knew that we had to do a lot of things to get our country right, but it really highlighted how serious the medical situation was when my father, who was working 40 hours a week every week just to try and keep a roof over their heads and food on their plates, couldn't afford basic medical coverage to get treatment that he obviously and desperately needed. I think the most appropriate answer is Medicare for all. It saves us about $700 billion a year compared to the current system. It gets everybody coverage, and it cuts out all of these issues that people currently run into between what kind of coverage is appropriate for them, if it's going to cover their prescriptions, if they're going to need this medical coverage enough that it's worth paying the cost of this particular plan. Insurance plans right now are incredibly complex, and that's by design. It's to maximize profit for the insurance industry while minimizing actual payouts to make sure that people get the coverage that they need. We have this whole industry that exists as a parasite on our country's backs. Because basically what we deal with right now is people deciding, is it worth gambling my health, my life, on being able to have just a little bit more money to live on right now? And that's unacceptable to me. I think we're well past time that we catch up with the rest of the developed nations in the world.
Okay.
I dual majored in information security and computer information systems. So, one of those big, really money-making degrees. And and until that visit, that was what I expected to do with my adult life, no matter how displeased I was with the current situation of politics. But I think if there's one thing that we need right now, it's somebody who's not a professional politician, somebody who can afford to sort of risk themselves on things that may not necessarily get them the funding of these big corporate donors that people currently rely on, so that they can actually work and fight on behalf of the people.
Okay.
I believe that what I have drawn as far as a plan for how we address a lot of our issues surrounding the Second Amendment strikes a very appropriate and realistic balance between everyone's right to bear arms and everyone's right to safety, life, liberty. So I have said from day one that the one thing that I will not support is further gun bans. I don't believe that we need to be banning more guns from all people. We need to be taking all guns from people that are likely to be dangerous and have proven themselves in such a way that they will be. For instance, folks that have real serious psychological issues, folks that have shown a propensity to sort of be likely to cause violence. And at the very least, we can get guns out of the equation long enough to get these people the kind of treatment that they'll need so that it doesn't become a serious issue. I have seen our current representative do a lot to go out of his way to act like he's taking care of people while actually harming the population. And that's part of why I chose this particular seat, especially with respect to veterans issues. In my experience, he has one or two very real, very substantial successes that he's done for veterans, and I applaud those. But I think the vast majority of legislation, of actual work that he's done with respect to veterans and on the Veterans Affairs Committee, has been harmful to our veterans. He has overseen cuts to veterans benefits, increases in TRICARE for veterans costs. Traditionally, veterans go to the VA and get whatever services they need. And we've seen cuts and cuts and cuts to the various VAs across the country. When the current president took office, we were understaffed to the tune of about 40,000 people across the country for VA staff. That number has risen to about 48,000 last I checked, and we've done very little to address that. Instead, we try to blame the problems on the VA system itself, and we start cutting off those services and sending them out to private industries at the expense of both the veterans who need that coverage and the taxpayers who subsidize it.
Kind of
Our solution to that wasn't, well, let's staff it so that we can address these claims in an appropriate and expeditious manner. It was, no, you know what, let's just drop a bunch of these claims in somebody else's lap and try to deny more coverage to other folks and generally cut down the services that the VA actually provides to veterans and farm them out to other people so that all of these for-profit businesses can start making that profit off of our veterans who have already dedicated so much of their life to our country and really just want to get some decent treatment out of it on the other end. Publicity. We're part of a coalition of Democrats who, like myself, are running in traditionally very red districts, very rural areas, called No Dem Left Behind. And we have a whole large team of folks out there that are working together to help us spread the message, both in this district and everybody else's district and around the country, to raise the profile of all of these districts and help people understand that not only do we exist in these rural areas, but we care about these people, and we're not just here to, get a little bit of publicity about it. We're here to take care of you. All right, well, short and sweet. I am a veteran, so I understand veterans' issues. I'm a local, so I'm not just some guy coming here from out of state to tell you what to do. But probably most importantly around here, I am pro-gun, I'm a patriot, and I love my family and this area, and I think that we deserve so much better than what we're getting, and I am prepared to give that to us. I believe that the most important thing that anybody can do for someone around here is making sure that we get medical coverage expanded to everybody, because right now, across the country, 2 out of every 3 bankruptcies is due to medical debt. That is tens of millions of families across the country that go bankrupt every year because they can't afford the kind of medical coverage that they need, because we allow these industries to continue profiting off of our suffering. I would say that that's, as we discussed before, the most important thing that I believe that anybody could get done right now, but it's not the only thing. We have so many other issues, specifically the environment, education funding, and 1,000 other things, and I don't. Yes, they can join us at chrisroweforcongress.com, and I have a whole host of platform issues laid out, and if there's any one specific issue that really matters to you, we have a contact form, and that goes directly to me, so I will see everything that you send there and ask us any questions, and as soon as I am able, I will personally address whatever concerns you may have.
In Johnson City, Jeff Keeling, News Channel 11.